Why is H. pylori so hard to treat for ulcers? Imagine trying to get rid of a stubborn guest who refuses to leave your house. That's kind of what treating Helicobacter pylori for ulcers can feel like. This tiny bacterium has some tricks up its sleeve that make eradication a real challenge. One major reason is antibiotic resistance. Over time, H. pylori has become more resistant to the antibiotics doctors usually use, especially clarithromycin. This resistance means the bacteria no longer respond well to standard treatments, dropping success rates from over 90% to around 60 or 70% in some areas. Resistance to other antibiotics like levofloxacin is also rising, which complicates choosing the right medication. Another factor is the environment inside the stomach. H. pylori loves the acidic conditions, which historically made it tough for antibiotics to work effectively. To combat this, doctors use medications called proton pump inhibitors or newer drugs like vonoprazan to lower stomach acid. This helps make the bacteria more vulnerable and boosts the effectiveness of antibiotics. But even with these measures, some strains of H. pylori are better at surviving in the harsh stomach environment, making treatment more complicated. The bacteria's load and the specific strain also matter. Some strains are more aggressive or resistant, which can lead to treatment failure. Plus, the number of bacteria present can influence how well the antibiotics work. If there's a high bacterial count, it can be harder to completely eliminate the infection. Patient adherence is another piece of the puzzle. The typical treatment lasts from a week to 2 weeks and involves taking multiple medications. This can be tough to stick with, especially if side effects occur or if the regimen is complicated. Missing doses or stopping early can give the bacteria a chance to survive and develop even more resistance. Standard therapies like triple therapy, which combines a proton pump inhibitor, clarithromycin, and amoxicillin or metronidazole, used to be very effective. But due to rising resistance, their success has decreased. As a result, doctors now often turn to alternative regimens such as quadruple therapy that includes bismuth or sequential therapies that switch antibiotics mid-course. These newer approaches can improve success rates but are not foolproof. In the context of ulcers, eradicating H. pylori is essential because it helps ulcers heal and prevents them from coming back. However, the bacterium's ability to resist antibiotics, survive in the stomach, and the need for complex treatment plans all make eradication difficult. It's important for healthcare providers to consider local resistance patterns and individual patient factors when choosing the best treatment. Always consult a healthcare professional for personalized advice. Remember, successful treatment depends on a combination of effective medication, patient adherence, and tailored approaches to overcome these bacterial defenses.